Dr. Subhash Salunke, member of the National Task Force on COVID, Senior Advisor, Public Health Foundation of India, is with us this morning. Dr. Anant Mohan, Professor and Head, Pulmonary Medicine at the All India Institute of Medical Sciences, also with us. Dr. Shailesh Jain, ICMR Scholar, and Dr. Shashank Joshi, member of the COVID-19 Task Force of the state of Maharashtra, is with us as well. Now, gentlemen, from a point when we were wondering whether India was going to have enough vaccine doses, when we were wondering about whether the pace of vaccinations could be ramped up or not, we have actually reached what is going to be a historic milestone, which is now just about 8,90,000 doses away, and we're keeping a close eye on that counter. Dr. Salunke, if I can begin with you, obviously there's no way we can take away from the huge achievement of this moment and the celebrations of it. Did you expect, to see this moment at this point? Would you have expected perhaps a higher number of second doses also being taken? Your thoughts as we approach this historic milestone.
Thank you. Thank you very much, Ankita. And let me congratulate India, my own country, for really achieving this spectacular success. However, as has been already indicated, there are a lot of issues that we have to take into consideration. Number one, this achievement is primarily because of the contribution of the health system. Even though public health has been neglected by India in last 70 years, we have to consider that even though the public health systems are practically not present in the urban areas, still the health system, the administration have done a marvelous job. Number two, I consider this is a positive approach taken by our people. So the second credit, I would certainly like to give it to the contribution of population of India, people of India who have come forward, even though there was no proper and appropriate communication strategy developed in initial period to address the vaccine hesitancy. And third group whom I would like to give credit is the scientists and the vaccine manufacturing industry. They have come to a particular level that our expectations are met by them. So these are the three entities, that is the health system, the administration, the people themselves, and the pharmaceutical industry. I think celebration is little premature. We have to appreciate, in your presentation, you have very clearly stated that only 21% or 22% people are getting 2 doses. We are heading for a serious situation unless we reach 60 to 65% of the people, total population with 2 doses. We shouldn't feel that we have achieved greatest success. Certainly there is a real need for us to focus on the job rather than doing the celebrations. Yes, celebrations are needed, certainly needed. But at the same time, we have to keep in mind the challenges are very stiff ahead, and we should have done it by August end. At least by December end, if we can achieve 2 doses, 60 to 65%. Absolutely no room for complacency.
Absolutely no room for complacency.
August,
yes.
October, November and December. In 3 months, 2 doses, 65% population of India. Then let us celebrate. Not now.
Well, October is almost over, Dr. Salunke. We effectively have 2 months and perhaps 10 odd days. So that's really not perhaps enough time to get to that target that India had set for itself. But Dr. Anant Mohan, if I can come to you, yes, point completely taken. We have to celebrate, but with a lot of caution. There are challenges ahead. Dr. Salunke is saying, we have to congratulate the people of India for coming forward and taking the vaccines as well. Now, over there, I'd like to sort of, stress on the fact that there also seems to be a great deal of what appeared to be vaccine hesitancy at the beginning has now become either vaccine complacency or, we could call it vaccine dropouts. Yes, they've taken the first vaccine, also at a time when COVID cases were rising. India saw close to 4.5 lakh deaths. There was this fear about COVID-19, but that fear seems to have waned right now with cases having gone down. But the fear of another wave still remains. So how do we then get all the people who have missed their second dose into vaccine centers? Is that going to be the big challenge? going ahead?
Well, yes, after having kind of congratulated the entire nation on achieving this target, yes, the challenges remain, as already has been mentioned. And the specific question which you are asking is that how to get the people into the fold. Fortunately, there have been people coming, but again, the problem comes that suppose there is still a little bit of vaccine hesitancy, especially in the people who may not be very well aware about the disease or the nature of disease or the problems it may face. Hence, to my mind, I feel a sustained public education campaign is also required, continuous public education campaign to tell them what are the benefits of the vaccine, what are the harms of not taking a vaccine, who are the people who all should take the vaccine, and maybe if there is a small segment who should be not taking the vaccine immediately. But as you know, there is hardly any condition where vaccine is contraindicated. There is hardly any such condition. I feel a good public education campaign sustained campaign should be there in place all the time. Complacency is likely to set in because the number of cases have gone down. People have started going out. As you can see, festival season is coming. In the next 2 months, there are likely to be a lot of social occasions. We have to be pretty careful about it. At the same time, we have to ensure that the momentum of the vaccination also doesn't fade away. In fact, if possible, we enhance it further. Like already has been said, the challenge is still huge. Only 22% fully vaccinated. In terms of absolute numbers, it is a good number, no doubt about it. But as far as percentages go, it is still pretty small. So we need to work on both these fronts and get the people back into our fold. In fact, many times we have seen in our clinics, many patients, when we ask them randomly, they have not got vaccinated, and we ask them why, and they are a little skeptical. So these kind of fears need to be dispelled with maybe by a continued education campaign.
So vaccine skepticism does exist, and I suppose the fact that overall COVID cases have come down drastically in a way has also boosted that kind of vaccine complacency that we're seeing right now. Dr. Shailesh Jain, apart from the fact that we have a significant percentage of the population not being fully vaccinated, we've also seen research that talks about how booster shots are required because vaccine efficacy does wane over time. But is India even at a stage where it can be thinking about possible booster shots, or is the entire focus going to be on getting at least 60% of the adult population vaccinated?
Ankita, as you have asked, we should have to think for the booster dose because the vaccine which we are giving as of now, it is very much effective against the Delta variant of the COVID virus. We does not know what is lying in the future. If the virus mutates and this vaccine is not effective against the future virus, we definitely have to think for the booster doses. First thing. Second thing, if we take the present scenario, the same virus comes again after 2 or 3 months. In that case also, the person who is senior citizen, immunocompromised, who is taking chemotherapy, who is undergone the bypass surgery, all the frontline warriors like healthcare workers, they should definitely go for the booster doses because we have already seen there are 2 types of immunity for the COVID virus. First is T cell and beta cell.
Right.
T cell immunity comes from the antibody level only that gains after the 6 to 7 months of the vaccination or after the 6 to 7 months of the infection of the COVID in second wave. We have already seen survey done in Gangaram Hospital in Delhi that vaccine production of the antibodies wanes after 5 to 6 months. So definitely we should go for the booster doses in the immunosusceptible population.
Dr. Shashank Joshi, give us a sense of, we've talked about this whole festival effect also. A lot of people now just focused on other things. They're in celebration mode and they can because, we have a bit of a breather, but we perhaps saw a similar kind of complacency just before the second wave hit as well. Where do you think India is overall? I mean, for instance, in the United Kingdom, which has far higher vaccinations, full vaccinations than we do, we're now seeing once again an alarming rise in the number of cases.
Ankita ji, you are very right. We cannot afford complacency. And when festive seasons come up and we saw Ganesh Festival, Onam, then Navratri, Dashera, now Diwali coming up, clearly there is a likelihood of breakdown of COVID protocols. And remember, the strongest vaccine against all variants is the mask. So it's an airborne droplet infection. So whatever happens, by the time the second dose gets administered, we still need to continue our masking protocols in place. Because remember, a good mask can still be intercepting the transmission. It is independent of any variant of concern or variant of interest. So I would recommend that for the next 6 months to next 1 year, we need to continue masking, absolutely mandatory. There has to be a zero tolerance for, breakdown of COVID appropriate behavior. That's number one. Number two, I think we should celebrate this movement, Ankita ji.
Yes.
Because single dose itself for such a large population is a huge boost. And remember, currently all the genomic studies in India are showing that we are only getting Delta derivatives. Unless and until there is new variant of concern or new variant of interest, it is unlikely that there would be any potential third wave, at least for the next 3 months. These 3 months we should use as an opportunity to ensure that the second dose hesitancy is broken down and is completed. We need to ensure that our healthcare force and frontline force is given boosters, as well as our immunocompromised population and the elderly population. And I think we should celebrate it with caution, and we should stop this revenge shopping, revenge tourism, revenge celebrations. That is something which is human mind. You see, human mind is fed up now. After 20 months, people of India need to become resilient, and they need to rise to the occasion by behaving appropriately. I think celebrations can be still individual. They can still be at homes in a bio bubble. But I think, public celebrations need some caution and care.
Important words of caution, and indeed, I think we've covered the whole gamut of reasons why we need to celebrate and reasons why we still need to be very, very careful. Dr. Salunke, Dr. Mohan, Dr. Jain, Dr. Joshi, thank you very much for being on Good Morning India.